So I want to ask Dr. Kovar this question. So Dr. Kovar, obviously, when we think about vaccines, you know, we're talking about obviously infectious diseases and things that can happen, but there are vaccines that are out there that can lower somebody's chance of cancer. Mm-hmm. What's your experience with the HPV vaccine? You know, because we're still finding some barriers.
Right.
I actually did it was last year. Dr. Chang invited me out to Benedictine University, and one of the audience members did ask about whether or not their child should be vaccinated against human papillomavirus. And I don't know if it was me or another panelist, but somebody said, do you want your daughter to get cancer? Right. So give us a little comments about that HPV vaccine.
HPV is actually my favorite vaccine because of what it prevents. And I tell parents, I think there's the misconception that people think, oh, I'm going to get this and suddenly my kid's going to go out and start sleeping around. That's not what this is about. It's that you don't know what's going to happen. And I tell parents all the time, the moms, you know, think of this, the difference is you go to the doctor all the time. As a woman, women go to the doctors a lot more than men. You would probably agree.
There's no doubt about that.
And women are going because they're going to see their OB-GYNs. And I tell them, think about it. You're going for your OB for your yearly, and you'll go, you know, you'll get the postcard, hey, normal pap, normal pap, normal pap. You have an abnormal pap, come in. You got caught. The problem with guys is we don't go to the doctor. And the only time we go to the doctor is when our wife, our girlfriend, someone has said, you know what, I'm really tired of your cough. Can you just get that checked? I think it's something. And the guy goes, it's nothing. And then what happens when they go, oh, by the way, sorry, yeah, it actually is something. So for guys, one of the big things is throat polyps that can turn cancerous. So for guys, I don't know, I just swallow, it gets stuck in the middle of my throat, so, you know, I just take smaller bites, I'll take smaller bites. And then by the time they actually go and say, fine, it's cancer, it's spread. You know, and because they're not going, and so by the time they finally go, it's too late. And then you're talking head and neck radiation. I give the example, my wife's a cardiologist, and she says the number of times that there's a man sitting there with his wife and he's like, I don't know why I'm here. She's just telling me I gotta go. I think it's just heartburn, it's indigestion. And when she comes back, she goes, okay, you have a coronary artery that's 99% blocked, and we're taking you to the cath lab now. She's like, that happens a lot more than you think, and on their way, she's like, you better kiss her and tell her, hey, you know what, you saved my life. And that's the thing with the HPV. The vaccine that we're doing now, it might not do anything for you when you're in your mid-teens, when you're in your early 20s, but it can come back to haunt you in your 30s and your 40s when you're least likely to do anything about it, and then when you finally do, it's too late. And so the commercials about it are, it's the kid who's, you know, it's a guy who's like in his 30s and it's kind of going back in time, and you know, it starts with it and it kind of makes you almost choke up. It's like the 12-year-old kid who's like, Mom, did you know that I could have been, you know, you could have prevented my cancer? And it's like, as a parent, you're like,
yeah,
some water in my eye.
I've seen the commercial.
Yeah, and
you're speaking the truth. And it turns out that really that now, well, it just got a new indication about a week or so ago, and now the HPV vaccine can go to age 45. But you're right, when it comes to head and neck cancers, 70% of head and neck cancers have been linked to HPV, but when you're looking at cervical cancer, I mean, I tell my patients, I go, this is basically a cancer vaccine. Like, get this vaccine. Hepatitis B vaccine, another one that can help lower somebody's chance of getting liver cancer.